Hi, and welcome to Three Questions with. I'm my friend Thomas with us from Health Markets. Good morning, Thomas. Welcome to the show. How you been, bud?
I'm doing great. Thank you for having me, Kevin.
So, Thomas, I asked you to come on the show today to talk about Medicare. And why I want you to do that is I don't know anything about Medicare, but it seems to be a big deal for people when you turn 65. So we can talk a little bit about, what you need to do to get on Medicare and why you need to get on it.
Yeah, Medicare, there's two ways to get Medicare. Number one is you turn 65 and are eligible for it, or you have a disability. And after 24 months, you get your Medicare that way, okay? So if you're getting the way of aging in, you call it at age 65, you have a 7 months period, your initial election period, where you can get on Medicare Part A and B. This is handled by Social Security. If you're not collecting Social Security, you actually have to go apply for it, okay? And you do that right on their website in one of their Social Security offices, or you can call them. And then once you get your A and B, then you come talk to a broker like myself that can help you with your prescription drugs, your Medicare Advantage plans, or your Medicare supplement plans, okay? I know people always hear about penalties that are involved, and
Yes.
that is true. But as long as you are covered with credible coverage, meaning a health insurance plan to a group or your spouse that covers at a minimum the same amount as Medicare does, you do not have to go on Medicare yet. Most people elect to get their Part A started because there is no cost to them if you worked for more than 10 years or 40 quarters, okay? So people get on their Part A and push the Part B to a later date when they no longer work and no longer get group insurance, okay?
Yep.
At that point, you ask for your Part B, and then again, it opens that initial election period where you can get your prescription drug plan, your Medicare supplement plan, or your Medicare Advantage plan.
So I think what happens that I've seen at least is people get overwhelmed with the choices and then they don't do anything. And now, unfortunately, you have no health insurance. So you really should sit down with you and understand all the different pieces because it's a big change in your life. You're maybe just retiring. You've always had company insurance. And now it's like, well, do I need Plan B, Thomas? Do I need these supplements? So to sit down with you and have you explain it to them really takes that burden off the person, right?
Well, the good thing there is there's no cost to a services like myself. I actually get paid by the carriers. There's no additional cost for the clients. And at the beginning stages, it is just an educational seminar, I would call it, a one-on-one meeting, where we just go over everybody's individual needs. And I'll explain how Medicare works. I'll explain how Medicare Part A works, how Part B, then how the supplements with the different letters work, or a Medicare Part C, and then also your prescription drug plans. And I'll give them all the rules and regulations, and then it's up to them to decide which way they want to go. The government does not make us take Part D or A and B for that matter, and everybody's in a unique situation. If you're a veteran and you get TRICARE, for example, there's also different rules and regulations that you have to deal with. And it's just a matter of going over them, explaining to them, and then, usually takes about a half an hour to 45 minutes. And then it gives them a clear idea of what they can and cannot do and what the costs associated with Medicare will be. Most of my clients, I say 99% of them, once they have the first meeting, it's kind of eye-opening and they're at ease of what they have to do. Because it seems way more complicated when you read up on it in the multiple books you get sent to your house and all the flyers and TV commercials you see all over the place. So it is not as difficult as it's made out to be.
But you mentioned the prescription plan. I find that that's a major issue for a lot of people. You're going along, knock on wood, everything's going well, and then unfortunately you become ill, and all of a sudden it's like, Tom, my co-payment's $300 a month on this. I didn't plan for that. I don't have $300. So thinking ahead, even if you think maybe, well, right now I'm okay, but maybe in the future I'm going to need this drug plan.
Oh, I agree. I mean, the drug plan is definitely one of those things where the government has, and it's not a penalty, but it's a late enrollment fee, okay? So for every month you didn't have credible coverage, it'll be 1% of the national average cost of one of those drug plans that will stay with you for the rest of your life. So it's important to get these drug plans set up early. But the good news there is there are drug plans for people who use very minimal drugs that are very low cost. So it's definitely worth it. You know, they're not going to cost you that much monthly now if you're not using any drugs, but later on, it'll save you from that, you know, late enrollment penalty. So it is helpful to have that.
Yeah. Sometimes, like I said, just that educational process where you know, we're human. We think today, you know, Thomas, you're not on any meds right now, and you think you're just going to stay that way the rest of your life. And I hope you do, but to be prepared for it. And so what's the best way for people to reach out to you if they have questions about this? How can they get in contact with you?
Yeah, I mean, I have my phone number there that you have on. I have a Facebook page, Google reviews, I'm on there as well. My Google business page, and email, phone number is the best way to reach out, and you know, communicate via text message if that's easier for them. And yeah, more than happy to sit down and have a chat with them, whether it's over the phone, via Zoom, or in person. Everybody's different. Everybody wants to deal with it in their own manner, and we're happy to help them.
Can you just share your email and phone number just so anyone watching will have it?
Yeah, so my phone number is 603-399-6687. My email is tpoeck@healthmarkets.com.
I appreciate you taking a few minutes to call into the show, and as always, thanks for being my friend.
Thank you very much. Thanks for having me, Kevin.